Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. We're excited today to be talking with Ashley Johnson. Before we get started, I do want to make sure we give a big shout out and thank you to Hubbard Radio for allowing us to use their space today and record our podcast. So today I'm talking with Ashley Johnson with the Missouri National Guard Counterdrug Task Force. And Ashley and I have worked together for many years in different ways and different capacities, but some exciting things have come over the last year with Ashley's role and the Missouri National Guard and Prevent+Ed. So we're going to dig into all of it. But first, I want to say hi to Ashley.
Hi, Jenny.
How you doing today?
I'm doing good, thank you. How are you?
Good. Things are going well. Yeah. So tell us first a little bit. I know I was asking you right before we started recording. I was like, Missouri National Guard Counterdrug program, and I said task force. I already messed it up, but that's okay. But so tell us, what does that mean? Tell us what is that for the National Guard? What do you do with the National Guard?
So I am with the Missouri National Guard Counterdrug program. All states and U.S. territories have counterdrug programs. I am with the drug demand reduction and outreach section of our program, which is working with community-based organizations and being embedded with you all.
Yeah, so that's the big news and the exciting news. So we as an organization, I mean, we've worked alongside the Missouri National Guard and the program for a long time. And I know that there's been different ways it's, happened in Missouri even before you and I were on the scene, right? But within the last year, so within the last few months, really, I forget how fast time goes sometimes, but we've been fortunate that our partnership has continued to grow and evolve, and we've been able to kind of let Ashley move in, right?
Yes.
And live with us. So Ashley now is embedded at Prevent+Ed and working alongside of our community prevention staff and helping in a lot of different ways, which is awesome. So it's been a great partnership, a great relationship, and we can talk more about kind of all that means. But before we get there, let's talk kind of previous to moving in with us.
Yes.
What were you doing? Like, what are some of the different functions in Counterdrug program and what happens?
So I was assigned as an analyst, and we have a partnership with law enforcement agencies. And so I did analyst work, and they have to have like a drug nexus.
So your work continues in the National Guard. You're a National Guard member. And then it was towards the end of last year, right? That, like I said, we've always really had a partnership with the Counterdrug program as an agency, as Prevent+Ed. I know from my early days at Prevent+Ed, I've worked alongside Guard members doing different community events and community coalition building, and that partnership has just really continued. And then last fall, I know you connected with me and some other staff at Prevent+Ed and started kind of floating around the idea like, well, what if I was able to kind of work even more closely with you all? And we thought it sounded amazing, and I hope you did too, and I think you did too, because you were like, yes, let's do this. So now you've been at Prevent+Ed for a little over 6 months now, I think, if my math is right.
Yes.
Which isn't always the case, but it might be. So what all things have you been involved with since you've joined the forces with Prevent+Ed too?
So I've still been able to support the coalitions that I was working with before moving over, and then immediately got trained for teen mental health first aid instructor right after I got there in December, which was fantastic. And then I was able to spend this school semester, January to May, in the high schools doing teen mental health first aid, assisted with sending the Narcan kits to school districts that request them. Then in April got trained to be adult mental health first aid instructor, and in the process to do military and veterans and military family mental health first aid, be an instructor for that. So
That's really cool. And that's probably something that hits home for you too. I hope that is a good connection between kind of all of your worlds coming together there, that specific module in military and veteran families. That's cool. That's cool that they offer that. And you said you're getting ready to go through that training, or?
Yes. So I did get registered, just waiting to be able to see the course so I can take it. But going to do our first, military mental health first aid in July, which is super exciting to be in with that community that I'm a part of, and be able to give them some information that they might not have known about.
Yeah. No, I love that. That's really cool. And I think that really speaks to when we talk about partnerships or collaborations or whatever buzzword is fancy at the time. I think that can mean a lot of different things. And sometimes when we talk about partnerships or collaborations, they can remain kind of surface. And it's like, oh, yeah, we partner with them. But I think that really displays true kind of integration and partnership when we're working together, we're sharing workspace, we're doing projects together, but then we're able to bring together those different parts of what each of us really care about, right?
Yes.
So, knowing that we've been doing mental health first aid trainings in a lot of ways, but then you're able to bring a perspective of like, hey, how about we add this component too? Mm-hmm. And I think that's been really powerful and a great part of continuing to be able to work together.
Yeah, I think it's a great thing to be able to offer the community because they're part of the community here in St. Louis. So it's nice to be able to add something to Prevent+Ed that you might not have had in the past. So I think that it works out for both agencies here. And
Absolutely.
I look forward to what we can do in the future too. So.
Yeah. I mean, I think that's just, gets your wheels turning about like, well, what else? What more can we do? And it feels like these last 6 months or so, I keep saying 6 months, it's been a smidge longer, but have flown by so fast.
I know. I was like, wow, it's over 6 months now. I keep wanting to say 6 months, but yeah, it went by super quick. It's been amazing being a part of Prevent+Ed, actually being at the office and being able to get involved in other, activities that are there, whether it's, putting the Narcan kits together before they're sent, or helping out with the tornado. That was really awesome.
That you were a huge help with that. Our small amount of response I felt like we were able to do as an organization, just assisting, people in communities. But, for you to just be able to hop in and say, yep, I'm going to help too. I think that was, again, part of the way that having different people in different positions within an organization can really just enhance all of the work that we're doing.
Yeah, I think it's great. I think that it's really nice for me to be able to reach out to the analysts on the program and to get information from them, like whether it may be drug trends that can be beneficial for especially the community-based organizations that we support.
Mm-hmm. Absolutely. So, a lot of our work is with the community coalitions, and we support, 28, 29 community coalitions. And as you said, you were connected to many of them and attending meetings and offering support even before really becoming embedded with Prevent+Ed. How has that been able to grow and change now that you're in office with us and we're really supporting all the coalitions together? Have you seen changes within that type of support?
Yes, I feel like I was only able to give so much of my time. So if I had a conflict of scheduling, I might not make as many meetings. And then I'm able to be involved with a lot of the planning for events or helping with, any type of flyer distribution before the take-back events are happening, which is something I tried to make sure to do. But I feel like I can spend all of my time focused on, them when I need to. And so just helping out any coalitions that need assistance that I might not have worked as closely with in the past.
Right. And how about having, a team around you. There's probably some things that you just get to hear and be part of through osmosis, right? Because you're there and other people are talking about it. How has that maybe helped you grow or changed anything, or your approach to the work too? Has it been different having this motley crew of people around you doing the work too?
Yeah, I think it's amazing just seeing the energy and how passionate they all are about the coalitions that they support, what they have going on. Just getting ideas of things that maybe a coalition you're working with could possibly think about, and just seeing the collaboration of coalitions within the region that work with one another to like multiply, like their forces.
Right.
And especially for events is really, really neat. And I think it's just amazing that being at the office, I love it.
Well, that's cool, because not everyone is like, I love going to the office and working. I think most people doing this work, of course they love being in the community and doing the work. And a lot of times people think like, oh, I got to be at the office because I got to do, the boring side of things. But that's great that environment is just supportive and helpful in continuing the work. So what's been your favorite thing over the last 6 months? The favorite project or thing or connection you've been able to make?
I think the teen mental health first aid has been really nice, getting the foot in the door there, and then just finding out about these other curriculums. I knew about adult and youth mental health first aid, but them having community-based ones, that has been really beneficial, especially for military specific.
Yeah, that military piece is
I
amazing.
think can be awesome. But I like being in the schools and seeing, the teens and hearing their aspects, like when you're going through the curriculum. And so it's been nice to not be in the office, but actually be out in the community and not stuck behind, a computer all day for 8 hours. So
yeah, because that can get pretty draining pretty quick. So this time in communities and connecting with people and even working with the high schoolers, right? Teenagers, they're always fun. But how, as you've gone through that and as you've really have had that opportunity to spend more time in community and spend more time with people and talking about these topics, everything from substance use prevention to community resources to mental health first aid and mental health concerns, what are there any needs in communities or things that have surprised you or things that have really just kind of made you think about or, made you rethink about what is really happening in communities and what some of those needs are when we're talking about substance use and mental health and the intersection of those?
I think just going into the high schools has been really nice to see, because you're in different areas of the community. And just talking with them when you get to the piece about substance use and asking them, what do you think is something that people might have, a drug overdose or poisoning,
right? And
hearing their answers when sometimes you're just looking at the data, but actually hearing it from them is very powerful.
Yeah.
Like, I think that brings a light to, like, this is what we need to focus on. And so it's a piece that you can bring back to your coalitions, especially if it's in their area.
Right.
High schools.
That youth voice. I mean, we talk about all the time how important it is to have that variety of voices around a coalition table or event or planning, and being able to help kind of highlight some of that youth voice is amazing. That's good. I love that. Thinking ahead. So, 6 months have come and gone pretty fast, and we hope that this is going to continue forever. We just had this conversation, I think, in the last couple of weeks. We're like, this could go on forever. Or maybe we could replicate it or do more or help other areas of the state or other communities, like, really figure out a good model to have this type of partnership and collaboration. But as you're thinking ahead, are there any ideas or thoughts of programs, activities, things that you would like to do even more of moving forward?
Well, like I said, definitely excited about the military and being in that community with the mental health first aid. But our hopes, is always to expand. We had I think the best thing was kind of seeing how this could work here and how you can, bring it to another possibly PRC and throughout the state and have another DDRO down, either in Springfield or Kansas City. But getting more support across the state is definitely always a wish. So,
absolutely. As you're thinking about the military mental health first aid, I know that's been a topic we've touched on several times here. But as you're kind of preparing for your own training in that, and then facilitating some training and next month, are there any things that you're really thinking that you might be excited to share, or response from that I know that we've had other conversations even on the PrevenTable with other veterans and people connected to the military about really the need and the mental health that people who are in our service field experience, right? So are you having any excitement or apprehension about anything that might come from leading those types of conversations too?
I mean, maybe some apprehensions just on, not wanting to, I guess, upset anybody about conversations. But I think with the curriculum, it really does have you kind of say, if you're uncomfortable, please exit.
Yeah.
And so I try to have someone there that can give support if they need to step away. So I think that kind of gets a little bit lower just because you have that support.
Right.
And I think that's why it's amazing. The team at PrevenTed as a whole, all the departments, it's one big team. Everybody helps everybody.
Absolutely. Yeah.
And so I am excited about the Teen Institute, though.
Oh, Teen Institute shout out. Applications are open, right?
Oh, sorry.
No, that's great. So Teen Institute, for people that don't know, this is a teen leadership retreat that PrevenTed offers in November. And Ashley's going to be part of Teen Institute this year as well. So people should definitely check that out, too. What are you excited about for Teen Institute?
I'm just excited for the small groups and the conversations that may come out of that. I just really enjoy, hearing from the youth and the teens and getting their perspective because like I said earlier, data is great, but it's really just hearing it straight from them is a lot different.
It's so different, and hearing their perspectives on it and their views, I enjoy that too. I think that can't ever be said enough how important it is to have those youth conversations and that youth voice. And they're just fun. They
are fun. And I think, too, that it's just a great program to offer. It's a lot more than, just the conversations, but just what I can get out of it from just being a part of it,
Absolutely. Well, anything else you want to share?
I don't know.
You don't know? All right, that's okay.
I'm sorry.
No, stop saying sorry.
Sarah told me not to.
Yeah, well, Sarah was right. Okay, well, Clay, you can edit that little banter. But I'm just really thankful to the Missouri National Guard Counterdrug program and, really trusting Ashley and PrevenTed to be able to try this out. And I think it's been a great opportunity, but also really successful. And, as much as you have said several times and, how great it's been to be at PrevenTed and have a team and the support, we feel the same about you. And having this additional really kind of staff member that has some flexibility around different types of programming or ways to be involved and perspective and interest has been a good part of the team. And I think that it's just worked in every aspect. And so, really, I think we hope the partnership continues forever or forever that we're involved at least. And hopefully it'll be something that we can have some legacy around, that maybe someday when we're, old retired people, we can look back at PrevenTed and be like, we helped start that partnership and that relationship and, the way that they work together. So just a lot of exciting opportunity and a lot of fun. And thank you, Ashley, for coming and joining me on the PrevenTable today.
Yeah, thank you.
If you liked what you've heard and you want to hear more, please subscribe to the PrevenTable at all of your favorite podcast stations. We're available on all the platforms. And thank you again to Hubbard for allowing us to use our space and record the podcast. We'll see you at the next episode of the PrevenTable.
Thanks for joining us at The PrevenTable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PreventEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The PrevenTable.